Good evening, everyone. I am Dr. Vinny Kantru. I'm a pulmonologist and critical care physician at the Indraprasth Apollo Hospitals, New Delhi. You are watching me live on this program, which is the Dr. KK's Med Talks, Wednesdays with me, Dr. Vinny Kantru. आज मैं आपके सामने एक बहुत ही इम्पोर्टेंट टॉपिक लेकर आई हूँ क्योंकि ये टॉपिक पल्मोनोलॉजी से रिलेटेड है। तो मैं एक प्रेजेंटेशन के द्वारा विद द हेल्प ऑफ अ प्रेजेंटेशन I would like to talk on the fact about inhalers. A lot of our people here in India do suffer from the problems of obstructive airway diseases, which means that they might have asthma or COPD as their underlying problem or any other issues for which they need inhalers or nebulizers. ये प्रेस्क्रिप्शंस आपने काफ़ी कॉमनली देखे होंगे और ये मेडिसिन्स लोग कई बार परचेज़ भी कर लेते हैं, लेकिन अनफॉर्च्यूनेटली ये कैसे लेने हैं, इस चीज़ का टेक्नीक उन्हें नहीं पता होता। तो आज हम इसके बारे में बात करेंगे, लेकिन सब कुछ से पहले लेट्स गो टू द हेडलाइंस ऑफ द डे। सो हेडलाइंस में क्या है? कोविड की न्यूज़ ऑफ कोर्स हमेशा ही जो है हेडलाइंस में ऊपर रहती है और हमने ये देखा है इंडिया में इस समय हम कोविड के केसेस छोड़ के इन्फ्लुएंजा के केसेस बहुत ज़्यादा देख रहे हैं। H3N2 जो है एक सब टाइप है इन्फ्लुएंजा ए का और इसी वजह से हम ये इन्फेक्शंस इस बार जो विंटर में वैसे ही वायरल इन्फेक्शन ज़्यादा होते हैं, द नंबर ऑफ वायरल इन्फेक्शंस increases during the winter इस समय बढ़े हुए हैं। कोविड वहीं जहां हम टेस्ट कराते हैं तो टेस्ट नेगेटिव आ रहा है जो कि बहुत ही अच्छी बात है और कोविड के इन्फेक्शन से रिलेटेड ही एक न्यूज़ आ रही है दैट somebody if they have suffered from COVID infection in the past might be considered equivalent to getting vaccination certification, which means that they might have had immunity which has developed due to the natural infection. British scientists plan to expand the genomic sequencing, which was being done for COVID 19 virus, to the flu virus, which is a very good thing. हमारे फ्लू के जो वायरसेस हैं वो भी आरएनए वायरसेस होते हैं और हर साल जो इनकी स्ट्रेन है वो बदलती है। इसीलिए जीनोम को स्टडी करने के लिए डिफरेंट कंट्रीज से जो जीनोमिक सीक्वेंसिंग आती है, ये ब्रिटिश सरकार द्वारा एक प्रोग्राम है जिसमें वो चाहते हैं कि फ्लू के वायरस को भी वो स्टडी करे इन द फॉर्म ऑफ जीनोमिक सीक्वेंसिंग। IIT Delhi has developed UNCTC, a deep dictionary learning to detect circulating tumor cells in the bloodstreams. IIT दिल्ली से काफ़ी पॉजिटिव न्यूज़ आ रही है। कल मैं पढ़ रही थी कि उन्होंने एक ऐसा टेस्ट बनाया है जिससे कि हमारे जो न्यूरोलॉजिकल डिजीजेस हैं जैसे पार्किंसंस है उसका अर्ली डिटेक्शन भी पॉसिबल हो सकता है। तो हमारे इंजीनियर्स जो हैं वो एक अच्छा काम कर रहे हैं, कमेंडेबल काम कर रहे हैं हमारी मेडिकल साइंस को आगे लेके जाने का। IIT दिल्ली हैज डेवलप्ड मेनी काइंड ऑफ टेस्ट व्हिच आर बीइंग यूज्ड for a lot of medical conditions, which includes the neurological condition, which is Parkinson's disease, as well as there is a deep dictionary learning to detect the circulating tumor cells in the bloodstream. Dr. N.K. Arora has said that sewage sampling results indicate no upsurge or new COVID variant here in India. आपने सुना होगा पहले भी कि सीवेज को टेस्ट किया जाता है किसी भी कंट्री में देखने का कि वायरल इन्फेक्शन जो है, जो कोविड-19 का वायरस है, सर्कुलेशन में ज़्यादा तौर पे है या कम है। तो यही वजह है कि सीवेज के सैंपल्स लेके उन्हें टेस्ट किया गया है और कोई अपसर्ज इन द नंबर ऑफ कोविड-19 केसेस इंडिया में अभी तक नहीं रिपोर्टेड है और कोई नया वेरिएंट भी नहीं निकल के आया है। बट दिस डजंट मीन दैट वी विल remove all the precautions which we have been following for so many years for COVID 19 infections. This means that our methods of prevention should remain in place and they should, in fact, be increased during the winter time. You should wear your mask, which is a very good protection against the cold air, the pollution which gets stagnant in this cold air in winter months, as well as the viral infection prevention, which includes influenza, respiratory syncytial virus, as well as the COVID 19 virus. So, this is a protection against this triple whammy which increases during the winter months. In addition, WHO supports the mask wearing on long flights given the rapid US spread of Omicron variant. ये हम पहले भी बात कर चुके हैं कि मास्क एक बहुत ही अच्छा इफेक्टिव तरीका है कोविड-19 के इन्फेक्शंस को बचाने का। वहीं दूसरी तरफ जैसे मैंने बात की रेस्पिरेटरी सिंसिशियल वायरस और इन्फ्लुएंजा वायरस को भी प्रिवेंट करने का ये बहुत ही बेहतरीन तरीका है। इसके अलावा जब हम देखें कि पॉल्यूटेड एयर जो है वो विंटर के मंथ्स में काफ़ी ज़्यादा देर के लिए रहती है क्योंकि जो कोल्ड एयर की सतह होती है, वो अर्थ के नज़दीक आती है और वहाँ पे काफ़ी देर तक रहती है क्योंकि वो हेवियर एयर होता है और लाइटर एयर जो होता है, जो वार्म एयर होती है, वो ऊपर की तरफ चली जाती है। यही कारण है विंटर के मंथ्स में जो एक्यूआई होता है या एयर क्वालिटी इंडेक्स के नाम से जिसे हम जानते हैं, वो काफ़ी ही खराब तरीके से हमारे सामने आता है एंड वी हैव सीन दीज़ डेज़ द एक्यूआई इंडेक्स ऑफ दिल्ली एनसीआर इज़ क्लोज़ टू 500 व्हिच इज़ वेरी, वेरी बैड। तो इसी के बारे में आज हम बात करेंगे क्योंकि हमने देखा है एक अपस्टिक्स इन टर्म्स ऑफ व्हीजी ब्रोंकाइटिस ड्यूरिंग दीज़ विंटर मंथ्स जिसकी वजह से हमें इन्हेलर्स या नेबुलाइजर्स का इस्तेमाल ज़्यादा तौर पे करना पड़ता है। तो अब चलते हैं इसी से रिलेटेड हमारे टॉपिक पे जो है हाउ टू यूज़ इन्हेलर डिवाइसेस एंड हाउ टू चूज़ देम। चलते हैं टॉपिक ऑफ द डे पे। मैं अपनी एक प्रेजेंटेशन भी अपलोड करना चाहूँगी। प्रतीक, वुड यू जस्ट हेल्प मी इन getting my presentation on the deck, or how should we do it?
Yes, ma'am. Ma'am, there's an option of present at the bottom.
Yeah,
So once you click on that, then ma'am, is there any animations in the slides?
there is animation. Yeah,
Yeah. So ma'am, there's an option of share screen.
it is showing me. Yeah, share screen.
Yeah. And then select the whole screen, entire screen, and then after that you can just share it.
Let me open my presentation.
Yes, ma'am.
So I hope you're able to see my screen now.
Yes, ma'am. Your slides are
All
visible.
right. So let's choose this topic, which is very, very important in our day to day life. We all have seen that wheezy bronchitis has increased during the winter months. This is being happening due to earlier detection of obstructive airway diseases, in which the main diseases are asthma and COPD. We have been able to detect them ably quite earlier and very, very effectively. In addition, this upstick in the number of chronic bronchitis may be caused due to the level of pollution which we are suffering here in India due to the stagnant air which remains there in winter months. So let's talk about selecting inhaler devices in the management of obstructive airway diseases. We have a lot of questions regarding the use of inhaler devices in our day to day life. So, what are these inhalers and how they go along? Let's discuss why we are discussing inhaler devices in this day and how is it important that we understand the inhaler devices effectively. There are about 230 drug delivery systems if we see the amount of drugs which are given in the inhalational therapy or the therapy which can be inhaled through your mouth to act upon the mucosa or the inner lining of your trachea. But still, on the other hand, despite so many number of delivery systems, we still have a very poor disease control. We have asthmatics and COPD patients who, despite purchasing the inhaler, do not know how to use that inhaler properly. which may be a deficiency on the part of the healthcare worker as well as on the part of the patient. So we would try to just obviate this gap today in our lecture. In addition, studies have shown that about less than 50% of their patients use their inhalers correctly. I would go a little further ahead. I would say if 10 patients come to my OPD, two of them know how to use their inhalers correctly. So 80% of the patients do not know how to use their inhalers correctly. This is despite the fact that they have been put on the inhaler for years and years together, still they have been taking it in the wrong way. Now you'll ask me, how did they get better with their disease? The reason is simple, because there is some amount of absorption which happens through the mucosal lining. That is why they were getting a relief in their symptoms, even if they were using their inhalers inappropriately. So, this trend has been there that less than 50% of the patients use their inhalers correctly. This trend is there for 40 years, which is a long period, and hence we need to intervene here and educate our masses as well as healthcare personnel for the correct inhaler device as well as how to choose your inhaler devices. The incorrect inhaler technique increases 50% risk of hospitalization, which means out of 10 of your patient, 5 will come back to the emergency or they will have acute exacerbation because of the incorrect use. And we have seen during these visits to the hospital or the emergency department, the clock shifts towards the use of oral devices, because both the patient as well as the healthcare personnel think that the inhaler device which the patient was on has not been working. Hence, they prescribe them oral steroids very commonly. Now, oral steroids have a higher dose and they have their own side effects and other problems which are related to their long-term use. Why do we use an inhalational route? What is the advantage of inhalational route? All of you will be surprised that the inhalational route of medication use was devised right here in India. It was through the use of Datura cigarettes, or the Datura which we see as early as 2000 BC in southern India. The dried leaves of Datura plant were burnt and they were inhaled. On the other hand, when the British came to colonize our country, they used to manufacture what are known as the asthma cigarettes. So they used to just roll these cigarettes and make these Datura cigarettes, because it used to have a benefit in asthma patients in terms of bronchodilation, which means that the breathing tubes were getting dilated in them through the use of these cigarettes, and the cause for the constriction of their breathing tubes was, of course, asthma. So this route has faster speed of action. There and then when you take your inhaler, the speed of action is very fast. It has greater safety. We are using lesser number of inhalations. We are using less amount of the medication. The dose is smaller. The dose required is smaller as compared to the oral route. And it has a greater efficacy as we compare it to the oral medications. The oral medications, when we take them, have to go through a lot of passages inside of our body, which can include first, which is the stomach. They have to be digested over there. A part of the medication is lost there, followed by the metabolism which happens in the liver, which is known as the first pass metabolism. There also we have a loss of a lot of the drug, and then comes the third, which is the bloodstream. Now, in the bloodstream also, the adhesion to the protein or non-adhesion to the protein also determines the amount of drug which reaches the particular site of action. These are all the off routes which are actually surpassed in case of the inhalational route. Hence, it has a greater efficacy. As I told you, a lower dose is required for these number of reasons than the systemic drug. Hence, we prefer this kind of medication in the form of inhalational therapy. Is there any effect of the particle size on the drug deposition? We know that our inhalers, which are of different types, which I will let you know in my future slides, the particle size is really, really important and it varies between different inhalers. The various inhalers which we have broadly are divided into the dry powder inhalers. We have the mist or the spray inhalers wherein the medication is coming out in the form of aerosol. Now, aerosol is the mixture of your solid or your liquid particle which is suspended in the air. Now, this mixture, it comes out in the form of a mist and gets deposited inside of your breathing tubes. These particles have a particular diameter to get aerosolized, which means that these solutions should remain stable when they have particular size of the particle. The third type of inhalation is the nebulization, which many of us know. The particle size varies between different sizes, different micrometers in the same inhaler. So the same inhaler might contain particles which have the size of 10 to 20 microns, which on one hand gets deposited mostly inside of your mouth because these are the heavier particles. The heavier the particles, the more early they will get deposited and in the proximal parts of your airway or your mouth. The next one is the 5 to 10 micron size, which mostly is filtered out or sedimented in your trachea, which is the main breathing tube, followed by the next generation airway or the divisions, which is tree like, which most of you must have seen in the image of the lungs. The ideal size particle which we are targeting in inhalers is between 2 to 5 microns. It's very, very difficult to achieve this size of 2 to 5 microns in these solid particles, which is present in dry powder inhalers, or on the other hand, in solutions of the liquid present inside the air, which is known as aerosol. So, the target particle which deposits inside of your lower breathing tubes where the problem of obstruction is happening is 2 to 5 microns of size. This is the particle size which we are targeting. And on the other hand, if we see the rest of them, they vary between 1 to 2 microns and less than 1 micron. Now, less than 1 micron is the one wherein the particle, the action happens due to diffusion. So, inside your airway, there are three mechanisms of deposition in the airway. One is your filtration in the upper airway, which means that they are just getting deposited once they come out of the inhaler. This is drug deposition happening with the 10 to 20 micron size. The next one is sedimentation, which happens between zero point 0.5 to 5 microns of size, usually less than 1 micron. They go on to the diffusion, which means that the particle can cross the membranes, which are the alveolar membranes, the breathing sacs which are there inside of our lungs. It passes that membranes and goes inside of your bloodstream. Now, this is the same particle size which we are talking about in pollution, which is responsible for the cardiac side effects of pollution. What are the types of inhalers? Though we have already learned it to some extent, but let me show you something about the inhalers. We broadly, if we see, we have three types, but the fourth one could be added, which is the propellant-free liquid inhaler. Both pressurized MDI, which means the pressurized meter dose inhaler, and propellant free liquid inhaler contain a liquid inside of them which gets converted into an aerosol once we actuate the inhaler, which means that once we press the inhaler. PMDIs, which is the short form which I'm using here for pressurized meter dose inhalers, are of two types. These are the standard PMDIs, and the second ones are breath actuated PMDIs. The dry powder inhaler has sometimes a unit dose wherein you, in simple terms, can understand that they have capsules in the form of capsules. The medication is used, and that capsule is loaded into a particular inhaler, which are known by different names, which can be the rotahaler, the revolizer, or it can be the Lupihaler. Usually, the pharma companies name it, by their own pharma company's name. So there are different types of these devices which use these capsules, and the dry powder comes out of this capsule and is inhaled inside. These, on the other hand, could be multi-dose, which can be a discrete disc formation of your medication, wherein the medication is stored in a diskette form, usually by the name of Seretide, which many of the people might have known here. It is in the form of a disc. The inhaler comes in the shape of a disc, and they have discrete number of blister package inside of them, which breaks once you inhale this medication. The other form is one of the reservoir, wherein each inhalation leads to the release of the drug off inside of your inhaler device. Nebulizers, on the other hand, might have been seen by many of us here. These are the small volume nebulizers or the large volume nebulizers. Mainly, they are divided into jet, ultrasonic, and vibrating mesh, depending upon the technology which is used for aerosolization of a particular liquid. Propellant free liquid inhalers, what do they mean? Now, each inhaler, when we move forward, if I show you the picture, this is the pressurized MDI picture, wherein you see this is the canister. Anybody using an inhaler should be knowing this better. They will be able to visualize this picture better. This is the canister, which is made up of aluminium. This is made up of aluminium to make it inert, so that the medication inside this container does not get sticked on to this container, and it is available for inhalation. Now, this is the chamber. This is the mouthpiece, wherein here it is covered by your cap, which is segregated here in this picture. And through this, the spray of medication comes out. This is the nozzle, wherein you press the inhaler. Once you press the inhaler, then through the nozzle, there is a spray of medication which comes out. If you see in this graphical form, there is a liquid which is filled up inside these canisters. Now, this liquid is pressurized liquid, which means that if this liquid was released into the atmosphere, this would get converted into a gas. So, under pressure, the gas particles get converted into a liquid, which we have studied in our chemistry. Many of us know that under pressure, this gas is converted into a liquid. Now, this is known as the propellant. This keeps it in the liquid form inside of this small inhaler. And once you press this nozzle, due to the pressure changes, this metering chamber is filled up with a particular quantity of this medication and comes out of this nozzle to make itself available in the form of an aerosol. Aerosol means the suspension of liquid or solid particles in the air, which is available for inhalation. So it is absolutely important to teach each and every patient that this canister or this medication or this inhaler should be kept in an upright position, so that there is no tilting, and the filling up of this metering chamber is appropriate to lead to a particular dosage form which comes out of this inhaler. So once we tell a patient that they have to take 2 puffs, you specifically have to mention it to the patient that these 2 puffs should be separated by a minimum of 30 to 40 seconds, because that is the time required for this inhaler to get back to its previous level of pressure equilibration, which is very, very important for this liquid to get converted into the gaseous form. So this is can be equated to similar mechanism which is there for a perfume bottle. When you press the perfume bottle many number of times, you must have noted that the first spray which comes out was a larger volume spray, and the next, when you pressed very early, is not such a large volume. So that bottle required some amount of time to get equilibrated to its previous level, so that the amount of drug which comes out of the inhaler is of appropriate quantity, because this filling chambers takes some time to get the requisite amount of liquid filled up inside of this metering chamber. So give your inhaler that particular time, which is 30 to 40 seconds for refilling. So each doctor should advise their patients to wait for a period of 30 to 40 seconds between two inhalations. Now, on the other hand, when we come to the characteristics and how much we should be using these kind of and telling our patients about these problems, let's go to the next of our recommendations. Priming, what does priming mean? Priming is very, very important for a new inhaler. If you're using the inhaler uh, just after purchasing it from the market, first four of the inhalations have to be discarded into the air. Now you'll ask me why this has to be there. The reason is simple, because as I showed you, the metering chamber requires some amount of time to get filled up, and there are various level of tubings, nozzles, etc. inside of your inhaler. So all these things require some amount of liquid to get filled up and fill these spaces with this liquid. So these four inhalations in the start of inhalation of a new drug should be discarded into the atmosphere. However, you should refer to the manufacturer's label. Each inhaler has this recommended and written on the use of this inhaler when a package insert is available for each and every inhaler, where this information can be stored and read. Apart from this, I already told you the interval between two actuations or pressing up of the inhaler should be 30 to 40 seconds. Gargling is very, very important when you are using your inhaler, even with the use of a spacer device. I'll tell you what a spacer device is. Why should there be gargling of your mouth after the inhalation? It's very, very important that the particles which I showed you, which was in the range of 10 to 15 microns, which was just getting deposited at the back of your pharynx or the part which is below your nose and behind your tongue, should get washed away with this gargling. It shouldn't stay there for two reasons. One is the fungal infection, which can happen due to the deposition of this medication there. The second reason is sometimes due to the deposition in the upper airway, which means the region above your larynx or the voice box. There can be a change in your voice, which happens due to the muscle changes which are there in your voice box. So make it sure that you are gargling after every use of inhaler. The third benefit is that systemic absorption of any kind of medication is reduced to a large extent, which can lead to side effects. Now, to minimize the occurrence of side effect, the following are recommended. The lowest dosage of inhaled corticosteroids should be used to control this disease. Spacer should be used during inhalation of the drug. Patients should be instructed to use the correct technique of inhalation. Rinsing of mouth and gargling should be done after each inhalation, and this gargling should not be swallowed, it should be thrown out of the mouth. The patient should be instructed to keep the spacer clean. What is the role of spacer device? You might have seen a bottle kind of a device attached to an inhaler, which is prescribed very, very commonly by your healthcare professional. What is the use of this spacer? Now, spacer, how do we define it? It is a holding chamber of 130 to 300 ml volume. This is the small volume spacer. Earlier, we used to have large volume spacers, which is 700 ml. The use was there previously because we thought that it would increase the amount of medication, but there is no difference between the two. And the recommended size or the volume of holding chamber can be between 130 to 300 ml volume, 130 for the children and 300 ml for the adult people. Now, you must have seen that many people have a coordination problem once they press this inhaler and they are instructed to take the inhalation deep inside of their breathing tubes to get this medication inside of their airway. This coordination problems happens with each of us because once you press the inhaler, the spray comes out. The moment you have to inhale there and then, it becomes very, very difficult sometimes to coordinate this action because of many reasons. It can happen in young also. However, it is more common in children as well as in elderly people. So for these people, we have to allow some time of inhalation, which varies between 2 to 20 seconds, for better actuation and inhalation coordination, which means that once the mist comes out of your inhaler, this mist can remain stored inside this bottle for 2 to 20 seconds and is available for inhalation for this amount of time, and it can easily be taken inside of your airway. The second advantage is that it reduces the amount of oropharyngeal candidiasis by filtering out the larger particles, because these larger particles now, instead of your pharynx, get deposited on this bottle and they remain there because of sedimentation. You know that by law of gravity, the heavier the particle, the earlier it is going to sediment. That is the reason that these particles get sedimented on this bottle kind of a structure. The other advantage is it reduces the cold freon effect. अब cold freon effect क्या होता है? The cold freon effect means that once the cold liquid comes out of this inhaler, which is between minus 20 to minus 40 degrees sometimes, when it touches your pharynx, say with a temperature of 0 degree, in a temperate environment. Let's take out winter, let's take out summer, let's take the atmospheric temperature as 0 degree. Even when something minus 20 will touch your throat, you are going to get irritated. So that is why few people, when they take this inhalation inside, they get acute bouts of coughing. That is known as cold freon effect. Now, due to that cough, the amount of medication which should have gone inside doesn't unfortunately reach your lower airway, and that is the reason that the effectiveness of your medication can go down. Hence, this can be reduced with the help of the spacer, which allows this aerosol some time to remain in that chamber and equilibrate these kind of temperatures between your body and the outside, which is the inhaler here, which we are discussing. The other thing is that deposition on your vocal uh, cord goes down, and that leads to less amount of muscle involvement of your vocal cords, which is called as the myopathy, which is actually considered to be responsible for the voice change. So multiple advantages of spacer devices. You can actually prescribe spacer devices for reduction of these side effects. Now, there can be two types of spacer devices. They could be valved or they could be non-valved. What do you mean by valved and non-valved? Herein, which is the mouthpiece of this spacer device, you can see that this is the part which the patient has to keep near their mouth. This is where from they have to inhale the medication. Now, there is a blue kind of a valve which is present over here, which means that once the patient inhales the medication, there is a one-way valve which will allow the inhalation to pass from here to here, from the bottle to the patient side, free of any obstruction. But if the patient blows into this bottle, it will prevent the entry of patient's air into the bottle. The reason is if the patient's hot air enters this bottle, or the patient's air per se enters this bottle, it changes the static electricity inside the bottle and drug deposition changes happen. Hence, this leads to decreased amount of inhalation medication which can be there and which can be problematic. What shape of these spacer devices is preferred? We have seen in studies that pear shaped is the one which is preferable most of the time. However, we have seen in India that conical ones are the ones which are most prescribed and available. Also, as we spoke about static electricity, due to static electricity, the drug medications can cling on to the walls of this spacer device. Hence, there should be an anti-static material coating inside of these spacer devices, which is very, very essential. We spoke about breath actuated inhalers, which is in a form revolutionary, or they could be considered revolutionary for the matter of fact that sometimes they do not need so much amount of coordination which is required for a spray or a propellant inhaler. This has a spring mechanism which is sensed by this particular inhaler. When a patient has less air flows, which means that they have more breathing trouble, it can be actuated and the drug can come out of these inhalers. Now, another problem with patients is that once they are very, very sick, they are breathless, they cannot have that power of deep inhalation and taking the medication inside. If a patient has less than 20 liter per minute of forced inhalation power, they are unable to take these inhalation medications inside of their lungs. This can be somewhat overcome by the use of breath actuated inhalers, wherein the peak flows could be between 25 to 35, which is less for a particular patient. The peak flow has to range between 100 to 120. Sometimes normal is very, very high, it is 300, 400. Now, during breathing trouble, it gets reduced to 100, 120, and sometimes less than 60 also. So, if it is less than 60, these breath actuated inhalers could be useful sometimes, and hence, this is their advantage over the pressurized MDIs, which we just spoke about in terms of coordination problems also. So this with this spring mechanism, there is no propellant inside of this inhaler, only the medication in the form of a liquid. It doesn't have a propellant which pushes out the medication out of this inhaler, but the spring action which gets activated with the inhalation of a patient, which releases the medication. The mantra for effective medication to come out of breath actuated inhalers is slow and deep inhalation. DPIs, on the other hand, if we talk about DPIs, here the medication is in the form of a powder, which is got out of the inhaler with the help of the power of inhalation of a particular patient. Herein, the power which we just spoke about in our previous slide should be more than 60 liters ideally. However, even on 40 liter per minute, this inhalation can be found effective sometimes, but it is more useful in COPD patients wherein the flow rates are higher, even during the problematic phase of the disease or as the severity of the disease increases. There are different types which we already spoke about. So let's just skip this slide. Nebulizers, when we spoke about, we talked about conversion of a liquid solution or suspension to fine mist or aerosol. The fill volume, which means the chamber which is provided for filling up with the drug, the fill volume should be ideally 2 to 4 ml, because there should be something for the electricity to act to convert it into an aerosol. So the liquid should get vibrated and should get broken up into smaller liquid particles to be aerosolized in the form of suspension of that liquid in the air, which will lead to the inhalation of the medication. So for this, some amount of liquid has to be there in the chamber. We have seen the minimum amount should be 2 to 4 ml, which should be the quantity of the liquid which you purchase from the market. So 10 to 15 minutes are required to nebulize this amount of medication. Anybody who has used nebulizers must be aware that there is a particular sound which happens when the medication gets over. There's a change in the sound of how your medication is getting aerosolized, and that change in sound is an indication that you should stop the medication, inhalation of that particular medication at that point in time. You might argue that there is still some amount of liquid which is left inside of that inhalation chamber. However, that is the resedimented liquid that comes again and again, and the amount of medication left inside of that residual volume is not much to be taken inside. So higher dose, we have seen that is needed as compared to your inhaler devices. It has higher dose available. If we compare salbutamol, it is 2500 microgram as compared to 2.5 mg, which is taken through the inhaler. Sorry, this is 2500 mg as compared to 2.5 mg, which is taken in the form of an inhaler. So jet nebulizers are pneumatically powered, which is the conventional bigger nebulizer, and ultrasonic and mesh nebulizers are the ones which are having a piezoelectric membrane or a piezoelectric region to convert this kind of liquid into the aerosolized form for inhalation. There are various handheld nebulizers also available these days, which are very, very handy. This is a pictorial graphic representation of how the liquid is converted into the aerosol in case of a jet nebulizer. Jet nebulizer is the one which makes a lot of noise once you connect it to the electricity. It is the bigger nebulizer, which is usually available in the price range of 2500 to 3500 rupees here in India. So here you see the liquid reservoir. At least 2 ml is required and maximum fill is 15 ml. It requires a driving gas or an air to get this liquid converted into the aerosol, which goes to the patient, and half the amount of medication is also lost to the ambient air, because for the equalization of pressure, we do require this side of this chamber to be open. Now, this driving force could be either the compressed air through the compressor, which is present inside of your box of that nebulizer. The ideal pressure is 50 psi, and herein the other source, as you might have seen in hospitals, is the compressed oxygen with a minimum flow of 6 to 8 liter per minute, which is required for this liquid to get converted into the aerosol, which again I am telling you is the suspension of liquid or solid particles in air. Now this liquid is broken into smaller droplets which get suspended in the air, which leads to the availability of these small particles for patient inhalation. Now, ultrasonic nebulizers, which are a step advanced, how do they operate? They have a piezoelectric crystal which vibrates at a rate of 1 to 3 megahertz present here at the bottom, and it creates certain vibrations in the liquids, and these vibrations are responsible for the conversion of this liquid, the ultrasonic waves, into the aerosol form. Now, this is the mist which is available for the patient inhalation, and particle size here varies between zero point 0.5 to 5 microns. Various advantages are there. This one is noise free because here the ultrasonic waves are involved. It's virtually noise free, and the effectiveness with which this liquid is converted into aerosol is quite effective. There is less amount of residual volume which remains there. However, they are more expensive. On the other hand, if we can consider the mesh nebulizers, they have a vibrating mesh in place of a piezoelectric crystal which was there in the ultrasonic nebulizer. Herein we have a membrane which converts the liquid by the ultrasonic waves into the aerosol, and that is available for your patient inhalation. This is how we compare between different nebulizers. The power source in case of the jet as well as ultrasonic mainly remains electrical or compressed gas, or in case of vibrating mesh nebulizers, we can have battery operated system also. If we consider portability, which one is the smaller one? Vibrating mesh is very, very small, and the treatment time required is shortest in vibrating mesh nebulizer. The residual volume, as we spoke, is sometimes very, very high in case of jet nebulizers, at least 1.2 ml remaining on an average at the end of it. In ultrasonic and vibrating mesh, it is low to the tune of 0.2 ml in vibrating mesh nebulizer. And on the other hand, if we compare the amount of cost which is there, the lowest cost would be for jet, while as the highest would be for the vibrating mesh, which is between 10,000 to 25,000 rupees. Now, this is a comparison between different inhalers, which we will come to later on. I'm going to skip certain slides. How to choose the correct device. This is very, very important. Very important. The age of the patient. If we have a small child which is less than 4 years of age, they wouldn't be able to inhale the medication with the help of an inhaler or the dry powder inhaler. Hence, less than 4 years, we usually prefer nebulizers to be used with the help of a mask. Or in certain children, the parents can help inhale their children with the help of an inhaler and spacer device connected to a mask. But in a small child less than 4 years, it's very difficult to nebulize to inhale the medication with the help of the inhaler. Hence, nebulizers are preferred in case of very small children. When the children grow more than 6 years, they know how to use their inhalers, sometimes without the use of spacer device. However, spacer device is usually preferred in case of children, especially between 4 to 6 years. They could be taught how to use their inhalers with the help of spacer and press upon the inhaler under the guidance of their parents. On the other hand, we have problems with the elderly people when it comes to the use of inhalation. The most common problem we have with elderly is with coordination. They cannot coordinate the actuation of the inhaler, the actual pressing of the inhaler, coming out of that mist and there and then inhaling it. That is why we prefer to give these patients a spacer device which can lessen the problem of coordination in this age group. However, if their power of inhalation has gone down, which could be due to the airway disease, or it could be due to the muscular disease which they have, or per se due to the frailty which is present in elderly people, we can actually prescribe nebulizers in this age group. But it is very important that you teach them how to use a nebulizer. Elderly people do have problems in learning new techniques, and they need to be taught and rechecked for the correct usage of nebulizer also. The availability of devices and drugs is also responsible for a healthcare professional to decide which inhalers they are going to prescribe. The patient preference and use. Your patient might tell you that I have a problem in coordination. On the other hand, we have certain patients who have arthritis problem. They are not able to press this inhaler and use their fingers in a particular manner. Especially true for people with rheumatoid arthritis. You might have seen people who have rheumatoid arthritis. They cannot bend their fingers, and it is very essential for a healthcare professional to see if their patient is able to press the inhaler to release the mist from out of the inhaler. The manual dexterity and strength, on the other hand, is equally important. If a patient is left handed or they have problems in coordinating various steps of inhalation use, you could prescribe them nebulizers instead. The peak inspiratory flow rate, which we already discussed, is directly proportional to the level of breathlessness which your patient has. Hence, this should be considered before any particular medication in the inhalational route is preferred for a particular patient. The cognitive impairment, which means that a person has some problem with their memory or usage of new products, you should see that who is their caretaker. Will they be able to provide the medication? If not, nebulizers would be preferable. However, as I emphasized, it's very important that we check they know how to use the nebulizers. Convenience of particular patient. They might be traveling, they might have certain kind of employment where they would not be able to use the nebulizer in the office. It also depends upon their daily routine and the preference for the portability that you might have to choose your particular device for a particular patient. Inspiratory flow rate and the baseline status of the patient. This has largely already been discussed, and you should be knowing when to use spacer devices, which we already discussed. Cost and economic burden for the patient. If you are prescribing two kinds of inhaler for a particular patient, you should check that the combination drug which might be these days available for these medications can actually be cheaper than three different inhalers. So please check these systems before you prescribe any kind of inhaler. This is the main decision tree, how we decide whether we go for inhalation device or whether we go for nebulizer for a particular patient. If the FEV1, which is a function of the amount of air which is expired out in the first second of expiration in a particular patient, and it is measured in the form of a PFT test, which means a pulmonary function test, which is carried out by a trained technician. It can tell you what kind of device to be decided for your particular patient. If this is less than 30, we preferably prefer the nebulizer or the pressurized MDI with a spacer or face mask. On the other hand, you could try with the breath actuated inhaler, which depends upon case to case basis. They will be able to inhale with this breath actuated inhaler. On the other hand, if we have a patient who has FEV1 more than 30%, but they cannot coordinate between the inhalation and the release of the spray from the inhaler, they also need PMDI with spacer or the dry powder inhaler. And if they cannot coordinate totally with this combination, also they would be prescribed the nebulizers. On the other hand, if you see that patient cannot voluntarily take inside anything, then you have to instruct them that you need a person who will get the medication ready for you in the form of a nebulization. And if it is a child, definitely less than 4, we will need a nebulizer. 4 to 5, we can try a PMDI with a spacer with the help of a face mask. So, if we teach the inhalation technique, how do we use the inhaler? It has a particular technique. As I told you, before each inhalation, you should be sitting completely relaxed and in an upright position. Take a deep breath and exhale out completely, which means that taking out everything of your lungs to the maximal possible effect. Once you exhale out, you have to shake your inhaler well, remove the cap, keep it between two of your lips, and press your lips completely so that no gaps remain between your mouthpiece of the inhaler and your lips. After that, you have to press the inhaler and inhale like this, which means that I inhaled slowly and deeply in case of a spray inhaler and remained there for 10 seconds, counting inside of my mind, 10 seconds, and then exhaling through my nose. On the other hand, if we consider dry powder inhalers, this action has to be faster and deeper. The reason is for the powder to come out of that inhaler device, you actually need quicker power to release those particles and disintegrate them from the rest of the particles. So the action should be quicker and deeper in case of dry powder inhalers, and it should be slower and deeper in case of pressurized MDIs or the breath actuated inhalers. On the other hand, if we see nebulizers, there is no particular action which is required for the inhalation. You can sit down completely, inhale deeply, and exhale according to your own comfort levels. However, in between, you should try to hold your breath for a period of 10 seconds for maximum amount of sedimentation which can happen inside of your breathing tubes. So, in nebulizers, do not forget to demonstrate the use and check for the understanding of your patient. Last but most important, counseling. Why we are giving these inhalers, how they should be used, what is the recommendation for their cleaning. Each of these should be explained very, very well for your patients. Let me stop my slide here. Hi Pratik, are you able to see me?
Yes, ma'am.
Yeah. So this is a brief account of how we choose our inhalers for particular patients and how these inhalers should be taken in an appropriate manner. If you have any questions, you can comment in the comment section. I would try to take the explanation as far as I can. Helen Jayadevi is here with us, and Helen, I have tried to use English as the main language today in the whole of my presentation. Pradeep Rawalji is here with us from Nagada in MP. Very warm welcome, Pradeep ji, to you. Satyendra Singh, namaste. Poonam Kishore Verma, namaste. Awadh Kishore ji, namaste. Rabia Umair, namaste. और अंशु सिंह जी हैं हमारे साथ, गुड इवनिंग बोल रहे हैं, नमस्ते प्रभास रंजन। और पूनम किशोर जी को ये टॉपिक बहुत हॉट लग रहा है, ऑब्वियसली आज बहुत ठंड है, देयर इज अ लॉट ऑफ कोल्ड आउटसाइड हियर इन दिल्ली एनसीआर with the temperatures you know getting down to as low as 1 degree centigrade, 1 to 2 degrees. So it's absolutely essential that we choose very very hot topics for you. I'm very very sorry that I got late today in coming to the show. That was due to an unusual traffic which I experienced due to something happening on the road. स्वप्ना जैन जी नमस्ते, हमारे साथ जुड़ने के लिए बहुत बहुत नमस्ते. गुड इवनिंग समय नायक. नूर आगा जी सलाम, आपको भी बहुत बहुत सलाम हो. आप पूछना चाह रहे हैं what is the difference between asthma and wheezy bronchitis. Now asthma is a condition which has many associated factors. It is the reversible airway obstruction which is present with a family history, and the particular patient gets these bouts of problems in their breathing consistently over a particular period of time, which is known as seasonal asthma, or it is present perennially, which means that it is present all of the time, which is the perennial asthma, which can be there. Wheezy bronchitis, on the other hand, means that your inside of your lining, which is the lining mucosa of your breathing tubes, gets inflammation, which is the bronchitis, and it leads to narrowing of your airway due to acute swelling of your mucosal lining. There is wheezing happening, which leads to wheezy bronchitis. This is a transient problem. However, this also needs inhalation medication for getting that inflammation out of the system. Poonam Kishore Verma ji, it is good to do mouthwash after taking inhaler. Yes, I have emphasized this fact that you should be using either lukewarm water preferably, or you can use a mouthwash also to be used after inhalation of each inhaler which you are using at your end. Anshu Singh ji, namaste. I hope you got your answer. What is the difference between asthma and bronchitis? In children, if there are more number of wheezy bronchitis, which are very common in children, wheezy bronchitis are due to the repeated viral infections which happen in children. Now, if they are repeated and they persist after a particular age, they are a risk factor for development of asthma in later age. So, viral infections in children can sometimes lead to the persistence of airway obstruction, which can take the form of asthma. But usually, wheezy bronchitis is transient. रति गुप्ता जी नमस्ते आपको भी. निर्मला गुप्ता जी नमस्ते. रति गुप्ता पूछना चाह रही हैं, प्लीज हिंदी में आप हमें कुछ बताएं. आज मैंने कोशिश की है कि मैं इंग्लिश में भी कुछ बात करूं, क्योंकि हमारे कुछ श्रोता चाहते थे कि हम इंग्लिश में बात करें, और क्योंकि प्रेजेंटेशन का मोड था तो यूजुअली जो लैंग्वेज होता है वो इंग्लिश होता है, लेकिन काफी कोशिश करी है मैंने कि सरल शब्दों में भी समझा सकूं कि हमने आज क्या समझाया है. केदार जोशी जी नमस्ते. हवन यज्ञ के द्वारा आयुर्वेदिक जड़ी बूटियों का प्रयोग भी ये मुझे इन्हेलेशन की तरह किया जाता है. यानी बताना चाह रहे हैं कि इन्हेलेशन जो होती है उस समय हवन यज्ञ में जो जड़ी बूटी निकलती है, हाँ, ये हिंदू धर्म में माना जाता है कि उसमें से जितनी भी हवा निकलती है वो वातावरण को स्वच्छ करने में ज़रूर हेल्प करती है. सो देयर इज़ saying, and there is a belief that once we do havan and yagya, which is there in Hindu traditions, the amount of the smoke which is produced by burning of these jadi booties can be actually purification system for the environment around these yagya which is happening. दीपक शर्मा जी नमस्ते, ज़्यादा बोलने से माफ़ कीजिएगा, शायद मुझे भी थोड़ी खाँसी आ रही है, लेकिन जैसे मैंने बताया कि दिल्ली एनसीआर में प्रदूषण की मात्रा और ठंडी हवा की मात्रा इतनी ज़्यादा है कि सब लोगों को जो है इन्हेलेशन में प्रॉब्लम आ रही है और सब लोग जो है वीज़िंग की प्रॉब्लम लेकर आ रहे हैं। वहीं मैं कुछ और सवाल लेना चाहूँगी, मैं पढ़ने की कोशिश कर रही हूँ। नेबुलाइज़र और इन्हेलर में कौन-सा अधिक कारगर है? ये डिपेंड करता है पेशेंट की कंडीशन के ऊपर। यदि एक पेशेंट काफ़ी बीमार है, तो उनकी इन्हेलेशन पावर कम हो जाती है और उस समय उनमें इतनी पावर नहीं होती कि इन्हेलेशन मेडिकेशन वो पूरे तरीके से अपनी साँस की नली में ले जा पाएँ। तो उस समय नेबुलाइज़ेशन काफ़ी इफ़ेक्टिव रहता है, क्योंकि ये जो इसमें एरोसोल्स बनते हैं, काफ़ी इफ़ेक्टिव होते हैं और नीचे तक जो है पहुँच पाते हैं और जहाँ पे बहुत ज़रूरी एक्शन होता है, वहीं जाके अपना काम करते हैं। वहीं दूसरी तरफ अगर आपकी ये पावर मेंटेन्ड है, तो इन्हेलेशन में जो कि स्पेसर डिवाइस के साथ यूज़ किया गया है और नेबुलाइज़ेशन में जब कंपेयर किया गया, तो कोई फ़र्क नहीं देखा गया है। हाँ, आपके पेशेंट के कंडीशन के ऊपर ये ज़रूर डिपेंड करता है। सरताज सिंह जी नमस्ते, विनय गुप्ता हेलो, पूनम किशोर वर्मा जी बहुत-बहुत शुक्रिया। अ, नाम मैं नहीं जानती लेकिन ये पूछना चाहते हैं क्विक एंड इमरजेंसी अल्टरनेटिव ऑफ माइल्ड ब्रीथिंग प्रॉब्लम। स्टीम इन्हेलेशन एज ओल्ड एंड वेरी वेल टेस्टेड। If you have inhalational problem due to your underlying disease, which could be asthma or COPD, then the inhaler which you are using for as your controller medication can be used SOS also, which means that while you have breathing trouble, it can be quickly inhaled and taken in. But if you do not have any underlying problem, you are developing some kind of breathing trouble, which is minor, steam inhalation can be tried. But if this breathing trouble is much more, you must see a healthcare professional immediately. Breathing trouble is sometimes caused due to heart ailments also, and that needs to be ruled out. विनय गुप्ता जी पूछना चाह रहे हैं, डू वी नीड टू ऐड डिस्टिल्ड वाटर इन नेबुलाइजर? बिल्कुल नहीं, क्योंकि मैंने बताया मोस्ट ऑफ द नेबुलाइजर लिक्विड्स जो आते हैं, द फिल वॉल्यूम इज ऑलरेडी 2 ml। इसमें कुछ और ऐड करने की जरूरत नहीं है, क्योंकि ऐसा देखा गया है कि यदि ये डिस्टिल्ड वाटर जो रखा गया है काफी दिन के लिए यूज होता है, तो इन्फेक्शन के चांसेस बढ़ जाते हैं। आप केवल दवा डालिए और उसे ही इनहेल करिए। केदार जोशी जी बोल रहे हैं मच अवेटेड एंड यूजफुल नॉलेज। थैंक यू केदार जी, आई एम हैप्पी दैट यू हैव बीन able to assimilate this knowledge and I was able to help somewhere. रेशमा जी पूछ रहे हैं till what age childhood asthma persist? If you're talking about wheezy bronchitis, then the different age groups in males and females are variable. However, most commonly it is seen till the age of 5 years. Till this age there is development of the immunity of the child which is happening, as well as there is development of your breathing tubes also. Small children have smaller breathing tubes which can get problematic even if they have less amount of swelling. Hence wheezy bronchitis is very common in children. So 5 is the age. Sometimes it can linger on up to an age of 15 years, which is the teenage, which is usually considered in case of boys. In girls, till 13 years, it can persist. So, teenage sometimes, but usually 5 to 6 years. What are the chances of conversion of childhood asthma to adult one? It is very difficult to predict. However, if there are certain risk factors, which could be the smoking of cigarettes or tobacco in case of parents, is a risk factor for development of asthma later in children. Also, a smoking mother, while the child was in the womb of inside of mother, if she was actively smoking, it is another risk factor. Pollution levels outside in our outside environment are also risk factors for development of asthma later in life in case of children who have childhood problems with the asthma or wheezy bronchitis. Increased amount of infections in childhood, which could include tubercular infection, is another risk factor for development of asthma and COPD in later life. Also, the genes are very, very important. If there is family history of asthma, which is running in the family, and history of consanguineous marriages, which is seen in some of the religions, can be a risk factor for development of asthma later in life. Also, the hygiene hypothesis is considered important sometimes. If we give a perfectly hygienic environment to our children quite early in their age and they are not exposed to many number of infections in childhood, they might develop the atopy kind of a picture later in life, which means that they have a predilection for allergic problems later in life, of which asthma is one of the phenotypes. So asthma happens in people who have tendency for atopy or allergic problems. This is one another risk factor for development of these kinds of conversion of childhood breathing troubles into adult ones. Agar agarbatti is dangerous is noted by Anshu Singh, which is very, very important. Yes, agarbatti smoke can be problematic for certain people who have a tendency for asthma like problems and who have allergic tendencies. In addition, I would also like to tell that the mosquito repellent sprays as well as mosquito repellent coils and fumes which are there for in form of certain you know those plug-in kind of anti-mosquito remedies which are available. I would not like to name any particular brand, but they are very, very notorious in terms of people, in terms of non-control of asthma. So people who have asthma and COPD can get problems with the inhalation of these anti-mosquito repellent sprays, coils, or the fumes which come out of the plug-in devices. So you should be very, very careful in using these. If you have problems, switch to creams, anti-mosquito repellent creams. That would be better. Trying to read another questions. Ishita, bilateral Krebs, should inhaler device be used or only antibiotics will give relief from dry cough? Ishita, this is a very basic question. This is a little raw data. Bilateral crepitations can have any number of meanings. Bilateral usually sounds like fluid overload, or they could have an underlying interstitial lung disease. You must work up the patient first to delineate what kind of a disease they have rather than pointing to inhalation devices. So we should first be knowing what is the cause of bilateral crepitations rather than jumping on to the inhalation device. Rati Gupta, my mother is diagnosed to have hypersensitivity pneumonitis. What all precautions she should need to take in day-to-day life? Can she use steroid inhaler in place of tablet? So Rati, if she has been diagnosed to have an hypersensitivity pneumonitis, there must be a cause for this hypersensitivity, which means that you have to find out the reason why this she had this hypersensitivity. There are various common causes here in India. One could be the use of coolers at home, which has been found to be very, very common in India. There is a mold which is responsible, mold which means fungal antigen, which is responsible for this hypersensitivity pneumonitis. On the other hand, there could be the pigeon antigen, which is responsible, or various pet antigens which are responsible. The primary thing which has to be there for further increase in HS, which means hypersensitivity pneumonitis, is the avoidance of this particular antigen. And these people have obstructive as well as restrictive defect in their pulmonary function test. Now, if they have obstructive defect, yes, definitely the inhalers in some cases do help. And on the other hand, due to their symptomatic relief also, we sometimes use inhalation. But this depends upon the severity of the patient if the oral steroids can be withdrawn. Usually 3 to 6 months is the time wherein we try oral steroids for HSP patients, which is the hypersensitivity pneumonitis. For bronchitis, which is the best inhaler or fast effective inhaler in cold weather like Kashmir, Ladakh, भगवान गायकवाड़ जी ये सवाल पूछ रहे हैं. ब्रोंकाइटिस डिपेंड करती है कि वीजिंग को ये वीजिंग की तरफ जा रही है या नहीं. अगर ब्रोंकाइटिस शॉर्ट एक्टिंग है तो लाबा यानी कि लॉन्ग एक्टिंग बीटा एगोनिस्ट दिया जा सकता है अकेले में. लेकिन वहीं अगर ये लॉन्ग लास्टिंग है और उसमें इन्फ्लेमेशन के भी थोड़े आपको जो है पिक्चर मिल रही है जो हम देखते हैं आफ्टर वायरल इन्फेक्शंस, तो उसके साथ हम इनहेल्ड कॉर्टिकोस्टेरॉइड्स को भी मिलाते हैं कई बार, और उसको उस कॉम्बिनेशन को लाबा आईसीएस कॉम्बिनेशन बोला जाता है. वहीं दूसरी तरफ अगर ये माइनर सी प्रॉब्लम है तो शॉर्ट एक्टिंग बीटा एगोनिस्ट भी यूज किए जा सकते हैं जिसमें सैल्ब्यूटामॉल आता है. लाबा का मतलब होता है फॉर्मेटिरॉल या सैलमेटिरॉल जो लॉन्ग एक्टिंग बीटा एगोनिस्ट होते हैं. इनहेल्ड कॉर्टिकोस्टेरॉइड्स डिफरेंट तरीके के होते हैं जिसमें ब्यूडेसोनाइड काफी कॉमनली यूज किया जाता है. मोमेटासोन भी अवेलेबल हो पाया है अब रिसेंटली. और वहीं दूसरी तरफ जो है कुछ और इनहेल्ड कॉर्टिकोस्टेरॉइड्स अवेलेबल हैं जो कि काफी तरीके के मार्केट में आपको मिल जाते हैं. ब्यूडिकॉट का इनहेलर जो होता है उसमें ब्यूडिसोनाइड होता है जो स्टीरॉयड होता है. कई बार ये एसेंशियल होता है ब्रोंकाइटिस की कंडीशन को ठीक करने में. Sometimes while sleeping, I develop breathing problem which awakens me what to do. Now, this depends why you have a breathing problem. You could be having sleep apnea because it is happening mostly during sleep. On the other hand, cardiac problems are also common during the sleep. So, you need proper evaluation before we come to a conclusion why there is breathing trouble. So, we do not have to jump to any conclusion before listening to your history as well as physically examining you what is the cause of your breathlessness, and after that only we will be able to prescribe you certain medications. रेशमा जी हमारे साथ हैं. वो पूछ रही हैं कि ऐसा देखा गया है इमोशंस एंड कोल्ड एक्सपोजर exacerbate the asthma in children. How to overcome it? This is very, very important. There are various triggers and increasing mechanisms which can worsen your asthma. One of the problems is sudden change in temperature. Temperature changes can trigger an asthma attack, as well as extreme emotions, which can include laughing and crying spells, can be problematic for children. If they have increased problems, counseling sessions and sitting down with parents can help in terms of emotional level. On the other hand, the temperature changes can be minimized by adequately covering your children in winter. We have seen inappropriate sense of using various clothes for appropriate environment and climates. So their head should be covered when they are going out into the cold atmosphere. The reason is simple because our blood supply to the head is very, very high. And once this head gets exposed to the cold air, the same cold blood gets down into your core of the body, which leads to acute changes in the temperature, and hence there is bronchoconstriction. For the same reason, their nose, their ears, and their neck and chest area should be covered adequately in cold weather. In hot environment, of course, there should be no sudden changes in temperature. If they are coming out from a hot environment, they shouldn't be let into a room which has air conditioned on at a temperature of 16 degree. So these sudden changes should be avoided. We are all aware that our ancestors used to tell us, don't come out of a hot bath and go out into the environment. We are also aware that people have been telling us, do not go into an AC environment when you are coming from high heat and you have just arrived at your home. So these things are very, very essential and very helpful in terms of prevention. On the other hand, drinking of warm water is also useful for the bronchospasm in terms of causing the heat and transmitting the heat from the food pipe to your airway. It leads to relaxation mechanisms. Exercise has the same effect because of certain good hormones which are released during the exercise and adrenaline which is released during the exercise. This also causes bronchodilation. So these are some of the simple things which can be used in terms of these temperature changes and emotional problems. Emotional problems usually happen due to mishandling by a parent. So, first, we should teach ourselves rather than teaching the children. Of course, I understand that we should not give in to their tantrums. If you are unable to correct all of these problems, you can take the help of a counselor also. So, Anupama ji, I will take this as a last question. Can we use inhalers in acute cases? As I explained, yes, these can be used if your patient is well enough, they are conscious, they have the power to inhale the medication out of the inhaler. They can be used in acute cases. However, if they have problems which can be gauged in terms of talking, if your patient is not able to talk, usually they will not be able to take the inhaler. There is where the nebulizer is going to be very, very helpful. You should be nebulizing these kind of patients rather than using the inhaler. I hope this information was important and useful for all of us here when we are connected in this cold night on a discussion about inhalers. We will connect to you tomorrow also with another hot topic to keep your winter cold nights absolutely warm. Thank you for connecting to us, and Jai Hind.